Nothing in this recording is intended as investment advice, and the people in this recording may hold positions in the companies they talk about. Do not make any investment based solely on a tip or recommendation. Please do your own research.
Hello and welcome to Zak's Traders Cafe. Today I'm joined by Nicholas Loebel, who's President and CTO at Ondine Biomedical. How are you today, Nicholas?
Great, thank you, Zach. Thanks so much for having me on.
Right, probably the first thing to start off with is maybe a quick summary of what Ondine is doing or trying to do.
Very good. Well, we have established a brand new approach to disinfection, which we've talked about over several years now in development, but has now really started to take off. This is an approach where we use a light activated compound. Indeed, that is a compound that we place on burns, on wounds, in endotracheal tubes, in your sinuses. The most important product we're focusing on at the moment, we place this substance, it's a stain, it's a colored agent, it's a dye stain that you put in your nose on a little swab. And that stain adheres to microbes, be they fungus, virus, bacteria, all the nasty bugs that tend to be breathed out by patients onto their own wounds, onto healthcare workers, and onto the facility in which they're being provided healthcare. And so when you activate that stain, those stained bugs with light, they immediately die. It's a very potent way to differentially kill microbes and leave your human cells unharmed. It takes just a minute or two. It's painless. There's no heat. And you eliminate all the bugs that can cause hospital-acquired infections. And let's just put that into perspective. Every year, 7 Wembley stadiums in the UK of people get a hospital-acquired infection. That's an infection that they received in the hospital, not bringing them in themselves, but rather communicated in a way that really is tragic from healthcare workers, from their own breathing onto incisions that they have, and from other patients. And we want that to be reduced as close as possible to zero. And we're in very good company. Very large companies around the world are working to the same goal. It's just that we think we're furthest along, and we're about to start to really see some traction. You're beginning to see 100% year-over-year growth, strategic partners coming on board, etc.
So wouldn't this have been, isn't it rather ironic that this would have been rather useful in Q1 2020?
Very good point. In fact, Zach, it might not be very well known by your social media group that we had a tremendous COVID few years in that we sold every single piece of technology we had into the marketplace. Every shift was producing product at maximum volume. We had non-traditional users, so not the normal hospitals buying the product to help protect their patients from infection, but rather meat processors, folks who had to maintain operations during the pandemic and could not continue selling product because workforce was being degraded at a rate that they couldn't sustain. Furthermore, especially in Canada, which is where we're mainly commercialized, the Canadian exports of pork products and other meat products to Asian countries and other countries around the world is one of the largest Canadian exports. And those countries tested the packages and tested the meat for the presence of SARS-CoV-2, the virus that causes COVID-19. And if that was detected, the purchase was shut down. We maintained a plant, actually more than one, that was doing in the $1 million a day range throughout the COVID pandemic, COVID-free, by having them treat their workers once a week. We did not make a claim for that. This was an on-use product, on-label use, because we're approved in Canada for nasal decolonization of potentially pathogenic microbes, which SARS-CoV-2 is one. And so the enterprising doctors in charge of safety at these plants deployed it in the workforce. And it was a tremendous win for us. Not only did we sell a lot of product, but we really helped keep Canadian industry online. We helped a great number of workers not get sick and maintain their livelihoods. And indeed, we saved a lot of animals because we stopped having the product being thrown away when SARS-CoV-2 was detected on the packages. So it was just a huge win-win for us. So no, in fact, we did very well, and I think the patients, if you will, the patient equivalents, if you will, and industry and society in general did very well by us over COVID. And we aim to duplicate that kind of experience, but now squarely in our target markets, which are in the pre-surgical environment, where patients are getting prepped for surgery, for that incision, and that's in major surgeries, ortho, spine, neuro, breast reconstruction, certainly cardiac, etc. These are the things that are pretty invasive and in which a microbe or two floating around can cause real damage, whereas before they were kept out by your skin. But we're also expanding into the intensive care unit, so a lot of interesting things happening with Ondine.
Right, I think there's a lot of interesting things happen, and you've got what appears to be an international scalable technology business, which is quite innovative as well. All that for a market cap of £21 million.
Well, Zach, let's see if we can work together to do something about that. I mean, I think we're one of the most overlooked, undervalued companies on the entire exchange. If you consider that this company has invested over 200 million Canadian dollars since its inception on developing this technology, when you consider that the markets we're looking at are multi-billion-dollar markets, I mean, there's more than 34 million surgeries occurring every year in the United States. We're just going into a phase 3 just prior to getting approval, obviously, for, we hope, in the next 18 to 24 months. And in that large market, we're teamed up with one of the largest healthcare systems in the world, Healthcare Corporation of America, who will be, we hope, deploying the system throughout their 200-odd hospitals and multiple thousands of points of care. In the EU, you're talking about equivalent thousands, more than 10,000 hospitals that could use this product simply to block patients from getting infections prior to surgery, and in the ICU from getting intensive care unit type equivalents. And in the UK, you have about 6 million people waiting for surgery, the largest waiting list in NHS history. Those 6 million patients are going to go through surgery, but then you can't afford to have them get an infection and come back into the NHS and now use a bed where a new patient should be. And they get priority because they're already in a suppressed state. They've already had their surgeries. Their systems are battling with the infection. Imagine an elderly person with a new hip, for example. That is a pretty morbid procedure. There's a lot of surgery. There's a lot of traction that occurs. There's some blood loss. There's a lot of potential for infection. A new shoulder, knee surgery that is not arthroscopic, things that are invasive. Those are the things that we can make a big difference of. And we're not talking about, a couple of percent. We're talking about reducing infection rates by half. We have a technology now which has been developed for long enough that we have seen over 200,000 patients being treated. We now have large databases of efficacy and safety. So we can tell you in the history of use, there's never been a serious adverse event associated with the technology. We've had 14-year retrospective studies over the very first deployments when we were just a pilot company doing a look-see to whether this would really work, all the way back to there with sort of 60% reductions in spine infections, which are very dangerous infections. Your spine is a superhighway, obviously, in the body, and any infection there can create a really bad set of downstream sequelae. So we have lots of data now that show that really this should be standard of care for spine surgery. Block the infections that start in the nose. So yes, it's difficult to see why we're so overlooked, but I think you're about to see some big changes in Ondine. I think we are now getting traction. It's beginning to become a self-sustaining process. We were at 6 or 7 hospitals in late 2022. We're targeting in the high 40s now in 2024 by the end of the year. And that's starting to look like a really substantial chunk taken out of our operating costs, our operating expenditures. So when you look at that, and you look at the fact that the first few hospitals have now adopted in the NHS, those are the North Pinderfield Hospital and in Pontefract and so forth. Now Leeds is also looking at the system to take it up. We're starting to get traction in the NHS because we were invited to move on to the supply chain. So that takes off the cap, the purchasing cap, which otherwise you have to be sustaining. And it's now easy for administrators to simply lift a phone and click on a mouse and order the product. So with the data coming out from a lot of studies, with health economic analyses coming out from 2 major organizations in the UK to demonstrate the cost benefits of this very inexpensive approach, for really a sum that is marginal compared to any of the expenditures in the surgery or, God forbid, an infection itself, which can range up to £100,000. You're talking about the ability to really save a lot of misery, a lot of comorbidity, and indeed many tens of thousands of deaths over a world population, which really it's a tragedy when these things occur because you simply don't have to have it happen. It's called chasing zero. There are many big companies doing it. These are technically avoidable infections. They represent lapses, unavoidable in some cases, difficult in other cases, and potentially simple in many cases. They're easy to avoid, but because of the pressure on personnel, because of the difficulty with hand washing all of the time, because you get patients coming in from, various environments, including where they've contacted MRSA sufferers, the big superbug, or they themselves are carriers of MRSA. Your pets can be carriers of MRSA. You have no idea where you can pick this up. They just come into the hospitals and they tend to communicate those bugs into the hospital environment, which then recommunicates to the patient. No fault of the patient, no fault of the clinician, no fault of the healthcare worker, just an unavoidable consequence of bringing, people who are carrying major bugs on their surfaces and in their systems into one location in order to get surgery. So we're going to do something about that share price if our lives depended on it. And part of that is working with large strategic partners now to really get traction to flow the system into multiple hospitals where we don't have reach, and do the clever partnerships, do the realistic partnerships that provide for a proper sharing arrangement of the upside benefits to both patients and ourselves.
Well, it sounds as though as you get the traction, your share price will follow. But in the meantime, Nicholas Loebel, President and CTO at Ondine Biomedical, thank you very much indeed.
Thanks so much, Zach. Appreciate it.